Addiction 101. There's a difference between substance dependence and substance addiction. And you think it's just semantics, but it's not. Dependence is if you stop doing whatever, you go into a withdrawal syndrome and you feel ill. Addiction is compulsive behavior. It's doing stuff you know you're not supposed to do, but you're going to do anyway to mitigate your dependence withdrawal. Does that make sense? So I explain this to a lot of family members because they don't get it. He's addicted to this and he transferred from this and just changed to that. I'm like, well, it's not exactly the case. But understand this is a neurochemical problem and it's not a lack of willpower. It's not a moral failure. There is a percentage of people that are at higher risk for addictive behavior. So people will say things like, oh, I've got addictive personality. Well, maybe you do. But understand that a good portion of that really isn't your fault. About 20%, which is 1 in 5, which is a shocking number to me, people that are exposed to opiates, for example, can become addicted to them, which is crazy because we dole it out so much in the emergency department. But that's a humbling thing for me. As an ER doctor who is now an addictionologist, I get the fact that some of that exposure was us in the ER, and a lot of that has to do with just not knowing. I met a patient who was 38 years old and many, many years into his addictive behavior, and he came to me, and I always like to ask patients, hey, do you remember your first episode, the first time you ever used drugs? And 99% of the time they do, which is very meaningful. So I said, okay, what was it? And he goes, well, I was 13. I'm like, okay, I'm taking notes. I was in the ER. I'm like, oh, ears perk up. And I had appendicitis. Okay. Nurse gave me morphine. Right? I fell in love. I'm like, whoa. That is very humbling to say because we do that all the time. If you have a perforated appendix, you're pretty miserable, and giving them morphine is not an unreasonable thing at all. But if you didn't know that 13-year-old kid was at risk for addictive behavior 20 years down the road, how would you have known, right? So it's difficult to screen for things like that. But understand that people are at risk, much like any other chronic medical condition. They are exposed, and it can lead them down a bad path. Some of that is not related to their own fault, their own wrongdoings. So the whole concept of, if you remember the Nancy Reagan days of just say no, it was the most ridiculous campaign ever. It's like telling a diabetic, just say no to insulin, just get your glucose under control, man up, you know. And I often say this, there are no groups of diabetics gathering, sharing bad coffee and stories in church basements about their diabetes. But it really is the same thing. It's a chronic condition. It's a neurochemical problem. So this affects a very specific part of their brain. And when I try to explain this to other people, look at it this way. If you're a baseball fan, you'll understand this. It's bottom of the ninth. It is game 7, bases loaded, down by 2, full count, whoosh, walk-off home run, okay? There's a dopamine surge in that player's amygdala that is so great that I swore you could douse him with gasoline and light him on fire and he would still run the bases. Why? He's so damn happy he doesn't care that he's on fire. So that's what we do artificially in the ER, right? You come to me with face up, but your legs are facing down because you flew off a motorcycle, and I'm going to give you enough medical grade narcotics that you don't care your legs are on backwards. And that's all we're really doing. It's a Jedi mind trick. I'm not doing anything for your pain. I'm just changing your perception of that pain. So now take someone who was at risk, who's not actually in pain, but they have a neurochemical imbalance of dopamine and serotonin such that this is their version of, say, anxiety or depression. And we give them a dose of something and we do this. Of course, they are so damn happy they don't feel their anxiety and depression anymore. So now your brain plays a trick on you. You know what? That was so good. We need to do that again and again and again. But you don't get to that same level. You get to a lower level and a lower level and lower. So what was 1 pill now is 2, which is now 10, which is now 20. What was initially a swallow a pill kind of thing becomes a crush and snort, and the crush and snort becomes IV injection, and you see how this progresses. So you have to look at addiction as a chronic condition, but you also look at it like stage 4 metastatic disease. You know, if you don't address it and treat it, it will kill you most of the time, right? And I often say that addiction has no cure. but neither does hypertension, neither does diabetes, neither does COPD, right? They're all treatable conditions, and you can live a long, healthy life as a diabetic or a hypertensive patient. Same thing with substance use disorder. If you get treatment for it, you can live a long, normal, happy life, but you got to get the treatment. And that's going to be in some format of medication-assisted treatment plus counseling. And not everyone's 50-50. I say this all the time. It's not 50-50. Maybe it's 80-20 or 20-80, but the two are synergistic, so you need both.